I guess I'll go into all of them, actually.
Okay.
I have paranoid schizophrenia, I have obsessive-compulsive disorder, and I have PTSD. And I treat all of them with CBDs. The first day I tried them, was one of the lowest days ever. I was on pharmaceuticals. They put me on something else I'd never been on before, and it's basically the last chance because I'd been on everything else. And it got to the point where, again, I was suicidal, and I ended up in the crisis unit at the hospital. And they told me I'd been there so many times that they basically weren't going to help me, because I'd been to the psychiatric ward probably about 25 times. And they basically said, we can't do anything for you. We don't know what to do. And I'd never had a crisis unit tell me that. It was kind of odd. So I was suicidal. I had a bad feeling I was just going to do, just end it and be done with it. And then I was researching on the internet, and I remembered, there's so many different cannabinoids, and I figured before I make a bad decision, I will at least research the multiple different kinds of cannabinoids and see if there's anything that can help me, because I knew they'd been doing more research on them. And I read about the CBDs, and I read about a research study at Yale Medical University, I believe, and it was saying that they had 21 schizophrenic people taking CBDs, 21 taking, I believe it was Risperdal, which is a atypical antipsychotic, and they, side by side, they didn't know which ones they were getting, and the CBDs actually, there's no comparison, the CBDs helped a lot more than the Risperdal did. And so I went to my local dispensary and got some CBD capsules, and I was at the point I thought nothing was going to help me, and I had no hope for it really. And my mom was with me basically doing suicide watch, and I was in her car, and I took a couple of CBD capsules because I didn't know the dosage I should take or anything like that. And she said literally within about 45 minutes of taking them, she looked over and I was smiling. And I was happy. And I basically, the whole rest of that day was like the opposite of what the beginning of the day was.
That's awesome.
And it's, one of the advantages I find is, as opposed to, even if an antipsychotic works for you, it's going to take at least a month to start working. I mean, they work for a few people, but I mean, it's going to take at least a month and a half to start working, if it does at all. CBD worked for me within an hour.
Nice.
So it's fast relief, it's better relief, and it's organic and natural. You can't really go wrong there.
Yeah, it's not toxic to the body.
I've had no adverse side effects from it whatsoever.
Excellent.
In fact, it's probably doing me some good in other ways I just don't know about. Right?
Yeah, good point.
It affected every facet of my life, in every way you can think of, from hearing audio hallucinations, voices and whatnot, to, like I said, just general paranoia of the public and not being able to function. It's affected being able to keep a job and family situation with my children and whatnot. So it's been an ongoing thing for many years. Been on every medication there is for psychosis. I've been on everything. I guess I don't need to name all of them. It's pretty much they've tried everything you can think of, and most of them have actually had a negative effect. Most of them, it's just like they say on the commercials, can cause suicidal tendencies, can cause this. They were doing that to me. They were doing the opposite of what they should have been doing, and they were making me question living, question, going on, things like that. And, I was actually better off without them, even unmedicated. So I cannot vouch for pharmaceuticals whatsoever. Let's put it that way. THC will actually bring out my symptoms. It'll almost double them. Since THC is a psychoactive drug, it can actually cause me to hallucinate, cause audio hallucinations. I don't have a lot of visual hallucinations, but it'll cause audio hallucinations and make me hear things and get paranoid. I won't be able to function around people or anything like that. As far as my obsessive compulsive goes, I will basically not be able to leave the house because I have to check everything so many times, and it does make my PTSD worse. I got PTSD from a shooting that happened at my house in 2005, and if I have too much THC in me, if I even hear like a car backfire, I'm jumping 5 feet in the air because I think it's a gunshot. And THC is detrimental for my mental health, but CBD is the exact opposite. Don't think it's your only option, because it's not, and there is hope, because the pharmaceuticals, not only do they not work on a lot of people, including myself, but they also have really adverse side effects. They can cause Parkinson's-like symptoms, and which CBDs actually help Parkinson's-like symptoms. So it does the opposite. It actually can help people as opposed to the other medications causing that. I would just say, don't knock it before you try it. Just try it, and you don't have to listen to what your doctor says. Your doctor is just going to tell you certain things that they're supposed to tell you, but you kind of have to be proactive and go try CBDs for yourself.